My name is Emily Bernstein. I'm the founder of Wheelhouse Health Navigation. I remember in 2019 sitting around the kitchen table with my family, surrounded by a mess of insurance papers, medical bills, and so much fear. We'd been bounced around from provider to provider, and no one was giving us the answers we needed. My mom had just been diagnosed with a rare brain cancer, and while we were trying to navigate a healthcare crisis, we were also trying to decode a broken system. It felt dehumanizing. But that moment and those endless calls, those unopened bills, all those rides to appointments, it lit a fire in me. My family's not alone. Nearly half of Americans say it's hard to afford health care. 1 in 3 people skip care because of the cost. 1 in 5 don't fill prescriptions because they can't afford them. And more than 4 in 10 people carry medical debt, even with insurance coverage. But these aren't just numbers. They're parents, caretakers, refugees, women juggling jobs and childcare while trying to keep their families well. I've been there and I've seen it, and I knew I had to do something. So I became a board-certified patient advocate, and I launched my company, Wheelhouse Health. We help people make sense of their care. We appeal insurance denials, negotiate bills, enroll people in benefits, and even set up the voicemail on your phone if that's what you need. We meet people where they are, both literally and emotionally. One of my clients told me recently, I had a fat stack of medical bills I was too afraid to open. Now they're gone, and I can finally breathe again. That's what we do. In just over a year, we've eliminated more than $1 million in medical debt. But it's not about the numbers. It's about the mom who can finally sleep, the refugee who gets the treatment they deserve, the grandmother who didn't give up. My vision is simple, a world where navigating care is possible and personal, where every community has a wheelhouse, where no one is afraid to ask for help. We're building it one conversation, one clinic ride, one appeal at a time. Because when we make healthcare human again, we don't just solve problems, we restore dignity. You don't have to be loud to be heard, you just have to be clear. My motto is the squeaky wheel gets the grease, and the steady voice creates change. So here's my ask. If you're feeling lost in the system, reach out. If you know the system, help someone else through it. And if you want to fix what's broken, support the work we're doing. We're not waiting for permission to help make healthcare better. We're doing it now, so join us. Share this message, donate to a cause if you can, volunteer if you're called to, be a voice, be a reason that someone gets care they otherwise would not. Let's stop making people choose between staying sick or going broke. Let's build a healthcare system that works for real people.